Today I will be performing endotracheal intubation. The first step in this is to check for my patient's ABCs, airway, breathing, and circulation. I check for their airway by lifting up on their chin and exposing the airway. I check for breathing by checking for chest rise and fall and placing my ear to the mouth to check for breaths. I check for circulation by using my middle finger and my index finger to feel a pulse. Once I have determined that the patient needs endotracheal intubation, I can now begin. The next step is to make sure I have all my supplies, most importantly my gloves. I have my oxygen source, my circulation device, my ambu bag and my mask, my tape, my 10cc syringe, my endotracheal tube and my stylet, my laryngoscope handle and my Macintosh laryngoscope blade, which I need to check and make sure has a proper working light source, which it does, and my stethoscope. An important step is to make sure that my endotracheal tube is secure. You do this by taking your 10cc syringe, inserting it onto the cuff, inflating the cuff, then deflating. If your cuff is completely deflated, it shows that your endotracheal tube is secure and ready for use. When it comes time to insert the endotracheal tube, the first step is to open the patient's mouth. I do that using my middle finger and my thumb. I insert my middle finger at the tip of the mouth or at the hard palate and insert my thumb at the bottom, opening up the mouth. I then grasp my laryngoscope in my left hand and insert it to the far right side of the mouth, going down to the base of the tongue. Once I'm at the base, I expose the epiglottis, and at the tip of the epiglottis and the base of the tongue, I see the vallecula, where I insert the blade, push forward, and pull up on the tongue. I then expose my vocal cord. Once I have exposed the vocal cords, I can then insert my endotracheal tube. I do that by inserting the tube right in between the vocal cords. I can then remove my laryngoscope, inflate my cuff, and remove my stylet. Now that that is done, I need to attach my CO2 indicator to the end of my endotracheal tube and attach my ambu bag to the end of the CO2 indicator. The CO2 indicator should change colors showing that there is CO2 present. I check to make sure it changes, and once it does, I know that there is CO2 and I have inserted the endotracheal tube properly. I then need to check for chest rise and fall symmetrically. When I see that, I can move on to auscultating for breath sounds bilaterally and making sure that there is no gurgling in the stomach. I do that using my stethoscope. I need to make sure that there are breathing sounds on both sides of the body. I also tape the right side. There are breathing sounds. I also tape the left side. There are breathing sounds. If I only heard breathing sounds on one side of the body, I would suspect mainstem intubation, meaning that I need to deflate my cuff, slightly pull back on my endotracheal tube, re-inflate my cuff, and re-evaluate. But seeing as which everything is okay, I can now move on to auscultating my stomach's patient. I check to make sure that there are no gurgling sounds, and when I see that everything is okay, I know that I have performed proper endotracheal intubation. I can now secure my patient's endotracheal tube using a piece of tape. I do this by placing the tape on one side of the mouth, wrapping it around the endotracheal tube, and placing it securely on the other side of the face. And that is endotracheal intubation.